Hello, my name is Dr. Nick Van As and I am the Chief Investigator of the PACE study. This information video will explain about the study and may help you decide if you want to take part. The PACE study is an international study which compares treatments for localized prostate cancer. You are probably watching this film because your doctor feels that this study is suitable for you. I would like to explain about the study and the different treatments which you may be given as part of the study. If your doctor decides that you are suitable, you will also be given written information to take home, and you'll have the opportunity to ask your doctor questions about this study. We hope this film will be a useful addition to this process and may answer some of your questions. The PACE study was designed by physicians and experts from 5 international academic centers. The study incorporates 2 separate studies, one comparing surgery and CyberKnife prostate stereotactic body radiotherapy, or SBRT, and one study comparing conventional radiotherapy and CyberKnife SBRT. You will only be offered the study that is suitable for you, depending on whether surgery or conventional radiotherapy would be the standard treatment option for you. The reason we are conducting this study is we do not know which of these treatments is best for you, or whether they are essentially the same in terms of controlling the cancer, side effects, and quality of life. For decades now, men with localized prostate cancer have been treated with surgery to remove the prostate, called a prostatectomy. We think that CyberKnife SBRT is likely to achieve similar cure rates to surgery, but this is not certain. The only way to prove this and to improve the advice we give to future patients is to conduct a randomized study. We will discuss the concept of a randomized study in more detail later in the video. CyberKnife SBRT is a method of delivering radiotherapy using a machine mounted on a robotic arm. It is given in 4 or 5 treatments spread out over 2 weeks. Prior to you starting your treatment, you will have 3 or 4 very small pieces of gold implanted into the prostate. The gold seeds are used to help visualize the prostate on X-ray images during your treatment. This is done in a procedure very similar to the prostate biopsy which you had done to diagnose your cancer, and takes about 20 minutes in an outpatient clinic. This will be done about 3 weeks before your CyberKnife treatment starts. And during this time, you will also have a CT scan and an MRI scan, which will be used to design the best way to deliver your radiotherapy. During treatment, you will lie still on a bed for around 45 minutes while the robot moves around you, delivering your radiotherapy. You can bring a CD or an iPod to listen to music during your treatment. The robot will not touch you and you will not feel anything during or immediately after your treatment. During your treatment, every 15 to 60 seconds, an X-ray of the prostate will be taken so that the radiotherapy can be exactly targeted on the prostate. All treatments have the potential to cause side effects, and CyberKnife SBRT is no different. However, it is important to start by saying that most men are likely to tolerate the treatment without any particular difficulties, either in the short or long term. There are 2 things we can do to reduce the chances of any side effects. The first is to ensure that your bladder is not empty during treatment, and so we will give you instructions about how to ensure that your bladder is moderately full during treatment. The second is to ensure that your rectum or back passage is empty during treatment, as this reduces the amount that the prostate moves. We do this by prescribing you enemas which you insert into your back passage to stimulate your bowel opening prior to treatment. We will give you further instructions about this in clinic. There are some temporary side effects which we see at the end of treatment and for 2 to 3 weeks afterwards. You may feel tired and you may experience some upset in your bowel routine, which may include diarrhea or discomfort in the back passage. We can prescribe tablets for this should it occur. The treatment may also upset your waterworks or bladder function, and this may include needing to pass water more frequently or a burning sensation as you pass water. In the longer term, we expect most men to have very few, if any, long-lasting effects of treatment. However, there are some rare complications which we should mention. Radiotherapy can produce lasting change in your bowel habit, which may involve you going less or more frequently than previously. Radiotherapy can also make blood vessels in your back passage more fragile, which can result in bleeding from the back passage. In around 10% of men, you may require some treatment, and in around 1% an operation may be necessary to correct this. The radiotherapy can rarely cause a narrowing or stricture of the tube which takes urine out of the bladder, and this can rarely need an operation. All treatments for prostate cancer involve a risk to your sexual function, and this can produce permanent impotence. The treatment will make you very unlikely to father children in the future, but you should use contraception if needed. If you are randomized to have an operation called a prostatectomy, then you will have an appointment with a specialist surgeon to discuss this. You will also have some tests like a heart tracing to check that you are well enough for an operation, as you will need to have a general anesthetic. You will come into hospital for typically 1 to 2 nights, and you are likely to go home with a catheter, which is a tube that takes urine out of your bladder. This tube may stay in for 1 to 2 weeks, but can easily be managed at home. All operations have risks, and your surgeon will go through these in detail. Principally, there are risks of the operation itself, the anesthetic, the chance of some blood loss, and a small risk of infection after the operation and some discomfort. In the longer term, the most common side effects after a prostatectomy are reduced sexual function and the risk of urinary leakage or incontinence. Many men are somewhat incontinent for some time after the operation, but 85% return to normal by 1 year post-operation. You will be infertile after the operation, so if this is an issue for you, please talk to your doctor. Occasionally, after the operation, after the prostate has been examined under the microscope, it is found that the cancer is more advanced than anticipated. If this occurs, you may be monitored more closely, or you may be offered additional treatment, such as radiotherapy, to reduce the chance of the cancer returning. Participation in this study is voluntary and optional. The quality of the care you receive will not be affected if you decide not to take part, and you will be offered whatever is the standard treatment option for your case. If you do decide to participate, then we will ask you questions about your health in general and about lots of specific symptoms concerning bowel, urinary, and sexual function. This is so that we can detect even minor changes in these factors over time, which may be related to the treatment you had. There will be 2 or 3 extra visits to the hospital for assessments if you take part in the study, but in general there are no extra scans or tests needed. Your follow-up after treatment will be much the same as it would be if you were not participating in the study. If you agree to take part in the study, the treatment you receive will be decided by a process called randomization. Randomization is a process that assigns research participants by chance rather than by choice to either the investigational group or the control group of clinical studies. Each study participant has a fair and equal chance of receiving either the treatments being studied. Neither the patient or the doctor can choose which treatment is received. We do this because we do not know which of the treatments is best for you. The goal of randomization is to produce comparable groups in terms of general participant characteristics such as age or stage of their cancer, and other key factors which may affect the course of the disease. In this way, the two groups are as similar as possible at the start of the study. At the end of the study, if one group has a better outcome than the other, the investigators will be able to conclude with some confidence that this is due to the treatment they received. Thank you for watching this information on the PACE study. We hope you have found it useful and interesting, and I hope that we have answered some of your questions. We hope you'd like to join us in this exciting project, which has the potential to improve the treatment for prostate cancer in the future.